It's fine. Okay, so thank you very much once again for the very kind introduction. And so in the next 30 minutes or so, what I'm going to discuss is briefly the patient's knowledge and understanding of heart failure and heart failure medications. I'm briefly going to discuss about the causes of treatment failure and non-adherence to treatment in heart failure, and ways as to how this could be overcome and how treatment or management of heart failure could be improved. So as we all know that heart failure has got a large prevalence all across the globe. Unfortunately, we do not have much data from this part of the world where I'm living and where Annette is living, is the Middle East. But we have some paucity of data, and there are just few reports. One you can see here from Oman. The prevalence is 0.5%. But as I said, that the data is lacking from this part of the world. Now, one thing we know by now, and this is from a recent study that claims that at least 1/3 of the UAE adults are at risk of developing heart failure. And this is mainly because of the lifestyle diseases they live with: diabetes, obesity, hypertension, hyperlipidemia, and a lot of tobacco smoking, particularly shisha, as you all know, is a very common smoking habit here. So that probably predisposes to heart disease, and that leads to heart failure. Now, heart failure, in fact, is a big challenge. And it is a challenge mainly because of the hospitalization and rehospitalization. Just taking the two countries or continents, United States of America, or North America and South America and Europe, the annual hospitalization is more than 1 million. And this accounts for more than 1 to 4% of the total hospitalization due to any other condition. Now, the sad thing about it is that 25% of these patients who are admitted and then they're discharged will be readmitted within 30 days. And at least half of them will be readmitted in about 2 months' time since they are discharged. These patients, they have got multiple comorbidities, they have got different needs, they are very symptomatic, there are a number of medications. So they tend to stay longer in the hospital, and their admission is anything between 5 to 10 days on an average. But patients sometimes stay for weeks and months together with heart failure. We all know that we have progressed in this 21st century with medicine. There has been a lot of advancement, a lot of research, and a lot of innovation in medicine. But the sad part is that heart failure still kills, and it kills very similar to cancer, if not less or more. And the other sad part of the story is that 50%, yes, 50% of the heart failure patients will die within 5 years. So you can imagine the scale of the problem, that 50% of the heart failure patients, since they are diagnosed within 5 years' time, till they get to their birthday in 5 years, they would actually die and would not live to see their birthday beyond that 5 years. Now, despite significant advancement in heart failure, treatment failure is now very well recognized. So why there is treatment failure? So treatment failure in heart failure is mainly because of the lack of knowledge as well as lack of understanding. Now, this is not only to blame the patients and their relatives and their loved ones. Some blame also goes to the physicians who are treating the heart failure patients. So they lack knowledge in the current guidelines of the heart failure treatment, how these patients are managed, and what are the new innovations and strategies that how heart failure treatment should be initiated and continued. Now, obviously, from patient point of view, once they lack knowledge, when they lack understanding of heart failure treatment, certainly there will be lack of adherence to the treatment that is prescribed. So the question is, where are we going wrong? So this is something that we need to discuss as to why patients are failing to adhere to the treatment, where there's a lot of emphasis has been made, a lot of research has been done on a number of medications. There are a lot of new innovations, there are device therapy in heart failure, but despite that, there's failure. Now, we all know that there is ample evidence for a lot of medications in heart failure, that they do save life, they do improve symptoms, but despite that utilization of these medicines are unfortunately not satisfactory. So keeping that in mind as a background, we did a very small study, and the objective of this study is just to see how the patients, heart failure patients, they understand and what is their adherence to the heart failure medications in our general hospital setting. So it was a simple study, just 1 year study. We prospectively studied 196 patients, outpatients plus inpatients, who were diagnosed with heart failure at our hospital. And the information was gathered by oral interview as well as using the questionnaire. Now we had in total of 110 patients. Out of these, majority were, 196 patients, majority were male, 110 male, and 86 female patients with an average age of 54 years. More than 3/4 were in NYHA class 2 or class 3 of heart failure class. Now I'm going to straight to results. I do not have time to go through all the statistics and so on. I'll just go straight to the results, and that is the key part of my talk. Now, the 15% of the patients of the heart failure in our pool, they stopped or reduced the dose of diuretic. As you know, diuretic does become a cumbersome treatment for some of the patients, especially if they're elderly, because as we all know that diuretics does bring about a significant change in the lifestyle of the patient, going to washroom quite frequently to empty the bladder and so on. So this was one of the reasons that 15% of patients had already either stopped or they had reduced the dose of diuretics. 36% of the patients believed that the ACE inhibitors or angiotensin receptor blocker were for blood pressure, and they did not know that this was for heart failure, and they had either stopped or they were intending to stop because they thought that either the blood pressure is normal or it is low, because heart failure, if it is a systolic dysfunction, by and large, you will find patients with a lower blood pressure. So that, keeping that in mind, if they are not educated, then obviously they would stop such treatments. 43% of the patients were not keen on taking beta blocker. As you all know, there's a lot of things discussed against beta blocker on the internet. And obviously people read a lot on the internet, and particularly for the medications. And the moment they read a few of the side effects of the beta blockers, which they may or may not have in the future, they do get very scared. And so 12% of the patients had already stopped taking the beta blocker on their own. Now, 54% of the patients reported that they were not informed by the prescribing physician regarding the purpose and the benefits of up-titrating the dose. As you all know, the heart failure medications, particularly the ACE inhibitors, the ARBs, and the beta blockers, they are usually started in a very small dose. And then what we do, we generally titrate these drugs gradually to reach to the maximum dose. So a saying goes that you have got to start low and you have to go slow. That means start in a very low dose and very slowly up titrate this medication to reach to the maximum. Unfortunately, if this is not being conveyed to the patient, they obviously they do not understand the purpose, and some of them will not go with the advice that has been given by the physicians. And 56% of the patient did not like the idea of increasing the dose of ACE inhibitors, ARBs, or beta blockers. Again, it brings us to the same question, whether these patients were adequately educated, they were adequately explained as to what is the purpose, why these medications are to be up titrated to the maximum dose. As cardiologists, people in this group will know that we do get the maximum benefit of these medications at the maximum dose. So our aim is always to start slow, but yes, and start low and then go slow, but increase the dose to the maximum so that we can get the maximum benefit of these medications. Now, patients were ignorant. Now, patients were ignorant not because of their fault. I think they were ignorant because of our fault, because we didn't educate them well. A lot of patients, at least 86% of them, did not know about aldosterone antagonists that we use in heart failure. 3/4 of them did not know the purpose of ACE inhibitors or ARBs. 70% of them did not know about the beta blockers. But the interesting part is that ivabradine is not a new drug. It's a fairly old drug now in heart failure. But none of the patients, yes, none of them, they knew why they were on this medication. They did not know anything about ivabradine. Now, we had in the questionnaire a very simple question as to what heart failure meant to them. Or in other words, how heart failure, what is the way the patients understood heart failure. So some of these sentences I've written here. So some said that heart failure is like a death sentence, or heart has failed beyond repair. Some would say that it is same like a heart attack. So many still believe that heart failure and heart attack, probably they are the same thing, whereas you all will know that they are completely different. And some would say poor link of symptoms, water fills your lungs. And a small proportion also said that they had absolutely no idea as to what heart failure is. So TNS UK is a body in the UK who does a lot of market surveys. And back in 2014, so they do basically the research surveys just to see from the general public point of view on different aspects as to what their understanding is, and how things are moving in the market. And they found that 41% of the individuals were afraid of stroke, 43% were afraid of advanced cancer, and 12% were scared of having a heart attack. But only 4% were scared of having heart failure in the future. And this is primarily because they did not have much information, they did not have much knowledge, or they were not aware of what heart failure is. So obviously the understanding is lacking, the knowledge is lacking about heart failure. Now this may be because of multiple reasons. So one of them is the cultural difference. Obviously, the culture in different parts of the world is different. Obviously, in the UK, where I practiced for many years, the culture is different. People, they do understand heart failure. There's a lot of education going on, a lot of awareness programs are there. So, but if you go to another country, maybe even underdeveloped countries, people will have a cultural difference, and there will be very little understanding about this heart failure. Personality and perception is an interesting part, because a lot of people, they Google, and they do see Dr. Google before they see actual doctors, as you all know. And a lot of them will make their own decisions about their treatment. They will have their own notions, what treatment they should have, what they should not have. So they are already prepared when they come to meet you. And even if you advise something, they may not take it very seriously. Education level obviously is important. And more important than that is age and the comorbidities that affect the mental capacity of this elderly population. So obviously they do not have that capacity to understand the disease. You may forget about the medication adherence and so on. So you do not expect much from this kind of population. But having said that, we should not leave them where they are. Obviously, these people, they need to be encouraged. There should be some means to educate them and make them aware of the disease condition first. Then secondly, make them aware of the treatment that we are advising. Now, heart failure, as you all know, over the years, there are a number of medications that have developed. And I've just put on the list on the left-hand panel there. These are the medicines and what it does in heart failure patients on the right hand. So I'm not going to read through all this, but this is very well known as to how heart failure medication they function. Now, some of them, they improve symptoms, but the majority of them, they improve survival. That means they help you live longer. And these are beta blockers, very well-known drug, ACE inhibitors, aldosterone antagonists, angiotensin receptor blockers. So these are the medicines that are very well known through a lot of research, a lot of trials, a lot of multi-center trials, a large randomized control studies that these medicines are indeed helpful in helping you to live longer if you have heart failure. Now, what are the causes of non-adherence to heart failure medications? Now, as I discussed in my previous slide, elderly population is at risk because of the multiple comorbidities, their aging brain. So they do have some cognitive impairment. They are forgetful. So obviously they cannot remember about, first, they do not understand about the heart failure. They may not understand what the medications are being prescribed. So they will be a little bit muddled. They'll be confused about these medicines. and they may also be forgetful. So they may not take the medicine that on time, or they may forget it completely. And too many pills again becomes difficult for someone, because as you know, heart failure itself sometimes maybe having like 6, 7, 8 medications in one go. Then if the patients are diabetic, then they will have few other medicines. If they have arthritis, and they will have few other medicines, and so on. So it does become a very cumbersome job for someone to have the full bag of medicines, just after or before breakfast, to swallow everything and then have the breakfast. So that is one of the downside of heart failure treatment, that these patients are indeed on a lot of tablets. Timings do not suit lifestyles. So obviously people have got different lifestyle. They have different timings to work. So obviously it is again an issue. Some people may not be ready to take diuretics when they're in office. Obviously, they are, it would be mean that they would be going to the washroom every an hour. So this is something that we need to look at, that lifestyle does hinder the treatment adherence. Side effects, increased diuresis, I've mentioned that. Cost is an important factor. We must not forget that some of the heart failure medications, particularly the ones we have, the new medication like ARNI. So this is the angiotensin receptor natru inhibitor. So these are the ARNI medicines. They are, in fact, they are very costly medicines. So we cannot give to all and say you take it. And they will take it for first time, but they'll struggle to buy in the future. And some patients may be misinformed because of the Google, the internet, absence of symptoms. A lot of patients may be compensated heart failure, so they will not have any symptoms at all, and they would feel that they are treated. And so if they are treated, why they should bother to take any medication at all? Patient education, as I said, is again very, very important. I have 1 or 2 slides on this, which I'll talk later in my talk. So this is one of the study, and that found that poor adherence to medicine was one of the main cause for decompensation in heart failure. Now, medication is an important, and there are different reasons why patients may not adhere to the treatment that they have been advised. Can't get the prescription filled, don't think they need the drug, and the drugs are very costly, afraid of side effects. Yes, afraid of side effects is another one. Not only for heart failure, a lot of medicines, like for hypertension, diabetes, everybody is afraid of side effects. And in particular, the statins, that lower the cholesterol. A lot of patients, they are afraid of statins, and they may forget to take their medicines on time. So what happens if the patients do not adhere, and we compare to those patients who adhere to the medications? So the patients who do not adhere to medication, obviously they will be more symptomatic. They are twice likely to be admitted to hospital with decompensation, meaning thereby if they had stable heart failure, they would come with acute shortness of breath, swollen legs, and so on. So they are decompensated, and that's the reason they come back to hospital. And if they do not adhere, they'll come back to hospital again and again. And if they keep doing this, then they are 3 times more likely to experience premature death. Yes, so they are more likely to die earlier than the others who will adhere to the medication. So I think this discussion is very important with the patients, that you take your medication, adhere to medication for 3 reasons. 1, to be less symptomatic, you do not come back to hospital again and again. And most importantly, that if you take medications regularly, adhere to what has been prescribed, the way it has been prescribed, then certainly you're going to live longer. So I think these are the messages, the key messages that should be passed on to the patients. Now, just to give you an example, moving outside heart failure now the adherence is not poor, not only for heart failure, but for the other medical conditions such as hypertension and diabetes, which is so common. Every 3rd individual, 4th individual is diabetic or hypertensive. You will see that the adherence to medication is not 100%. It's not even 90. It's not even 80. Not even 75. It's just close to 70 only. And for statin cholesterol treatment, just see the adherence is less than 50%. So what is the implication when the patients do not adhere to medication? I'll just would like your attention at the middle part of this slide. So as you look here, the 20%, it leads to 20% increase in the hospitalization. It would also lead to 80% increase in the cardiac event. it leads to almost 125,000 deaths per year. And obviously it adds to the cost. So additional cost, this data has been taken from US. So there's additional cost of $2,000 to the healthcare system if the patient do not adhere to the medication that has been prescribed to them. And obviously, we need to find a solution. We just can't go on talking and just go on saying that the patients are not adhering to treatment and why they're not adhering to treatment. But there has to be some means to find a solution that how we can overcome this treatment failure. And remember that the heart failure treatment is a costly issue. These patients, they stay in the hospital for a longer period of time. They tend to exhaust the resources, both financial and the manpower resources of the hospital. So certainly we need to find a way that these resources are not wasted. So the government has to be taken into partnership. They must be important stakeholder and in the policy making when we make a policy for the heart failure treatment. We must increase the awareness about heart failure in general public. And obviously the multidisciplinary team approach is a good way to go ahead and manage these patients. So these patients should be followed up frequently. Now, one of the initiative has been taken in Middle East that is going back almost 4 years ago. There was a launch of the roadmap for heart failure treatment. And here we did invite the government as a stakeholder to be a part of the team to go about this roadmap that was developed for heart failure management. So the policies were laid, the top government officials, they were invited to these meetings, and the heart failure treatment was discussed with them, what heart failure is, what the scale of the problem is, and how the government can help us to develop this the policy and the roadmap for the heart failure treatment for the future. Likewise, it was in February 2017, I led the first heart failure awareness campaign here in Bahrain. And it was well attended. We got a lot of good feedback, and we increased awareness in different ways. We arranged follow-ups, we arranged screening programs for heart failure. And obviously this is still being continued, and people have become aware. Not all of them, but the majority of them did learn a lot about heart failure. We did start to see a lot of patients who came through our door for the heart failure treatment, not only in our hospital, but in other hospitals as well. So certainly the heart failure awareness campaign has helped. People have become a little aware that they know about the heart failure. In addition to this, we have also done some patient evenings. So it's not like we few doctors, we chit chat and sit together. No, we do talks with the patients. So we do it like 3-4 hours. These are open evenings. They can ask any question if they have any queries. So it's like a good dialogue between the physician and the patients. So where we can explain to them what heart failure is, what they should do, how it can be screened, and how they can be diagnosed early, and what treatment options are there for them if they need treatment. So likewise, optimization of heart failure care is important. So the optimization of heart failure should be before discharge. A full planning should be done as to how the heart failure is being treated. There must be a full pre and post hospital discharge checklist. So make sure that the patient, they fully understand about heart failure. Not all the medications have been given and prescribed, or they have to be taken, and any other parameter that needs to be looked at before their discharge should be fulfilled. And the job does not end there. These patients should be followed up. They should not be left on their own. They should be educated. There should be heart failure nurse in the community that should be following up these heart failure, educating them. If there's any need, then obviously that should be sorted out in the community. So they should not come back to hospital just for small things. So that is the reason the system has to be integrated between the primary, secondary, and the tertiary care. And the patients can sometimes be very well treated at home if we have a good system at the community level. So that is the beauty of having community heart failure nurses. In some countries, I've seen, particularly in the UK where I work, so there are community nurses, dedicated community heart failure nurses who look after these heart failure patients, who educate them. And heart failure patients, they are well informed, and they do not bounce back to the hospital for any trivial condition. So it has to be a multidisciplinary team. And again, the pharmacists, I'll just mention on this slide, they again play a very important role. The nurses play a very important role. The physiotherapists play an important role. Heart failure nurses, I've already said. So it is a teamwork. So as you can see on the slide, the pharmacists have got to contribute tremendously to the management of the heart failure patients. They help best in medication reconciliation. They would look at what heart failure treatment they are taking and what treatment they are not taking. So this is the way we can find out whether the patients are adhering to the treatment or not. So they will make some telephonic reminders about the medication, they will do individual coaching, and they will help with the medication management and so on. So this is one of the booklets we give for the heart failure patients if they're admitted. And so obviously it gives the patient a lot of information about their diet, about the fluid intake, about the salt intake, about the sleep, about the exercise, and so on, and what symptoms and they should look for, what are the triggers that can decompensate a stable heart failure to a decompensated heart failure that will help them, that will lead them to come to the hospital. Now, obviously, when we talk about medicines, we talk about evidence-based medicines. Now, whenever we prescribe evidence-based medicine, this evidence-based medicine should not be buried within ourselves. This has to be discussed with the patient. We have to tell them about the treatment that we are prescribing. We tell them what is the evidence as to why we should give that medicine to the patient, what is the benefit that patient is going to have. And we should back this argument or discussion with enough evidence from clinical research or trials. And if we give that information, then the patients are more likely to get your advice on the medication. And obviously they become more confident with these medicines and they become more comfortable. And once they're convinced, confident, and they're comfortable, certainly they're going to be more compliant and they'll be more adherent to the medication that you have prescribed. So this is my last slide, but this is a slide that is very close to my heart. And so never leave the patient just with the prescription. You please spend at least even a minute, if you have, educating these patients. So this is the key aspect for medicine adherence. So patient education, not only in heart failure, in any area of medicine, patient education is important, and you have got to spend some time educating our patients. So with that, I thank you very much. And if there's any question, I'm ready to take.
Syed, I must say, in our place of the world, you see more and more younger people with heart failure, with hypertension. You know, imagine a 19-year-old on 2 antihypertensives. They're normally diabetics, they're overweight. Yeah, you can say they must exercise, but try to exercise in a 50-degree heat. So yeah, this is a lot of education that needs to happen here. And I can see that you also see it in your country now. The other countries are more aware of education and they more aware of questioning. But I see in our part of the world, it's a little bit difficult.
Yep. Yeah, I think I would say there is a cultural difference. And again, maybe I won't blame the patients altogether. Perhaps it's a cultural difference from the physician side as well. We perhaps do not